frustrated last week. Oh, here we go. We are live on YouTube.
We are live. Good afternoon, everyone. This is Minister Rattray. I am from the Upper Room United Christian Assemblies, and I'm here with someone that I have definitely grown to admire, none other than Mayor Sean Patterson Howard, the mayor of Mount Vernon, New York, and she's here to share some wonderful information with us today. Madam Mayor, I just want to say I really do appreciate your time.
Absolutely.
I
Always
really do.
glad to be of service and partnership.
And I know that when we first spoke about this, it was 2 weeks ago, and this was the number one topic on everyone's mind. And right now, almost I'm like split. Half of me is saying, this is not what people want to talk about right now, but the other half is saying that we need to get these churches back open, because if there's anything that I believe people need at this time is some moral guidance, some spiritual guidance. So I'm hoping that you'll be able to share some information with us today. Help us understand, where do we stand from a government standpoint? What are some of the guidelines, or where do we stand with some of the different phases? You have the information. I may not have the right question to ask at the moment, but I'll definitely turn it over to you and say, first of all, is COVID still a thing?
COVID is still very much a thing. And that's something that we really have to understand. I mean, we are excited and we are blessed that the level of the crisis has subsided. But that means that we have to be ever more vigilant. And making sure that people are still understanding the importance of social distancing. I still have my masks. They go with me. I'm in my office and I'm here by myself, so I don't need my mask right now. But when we travel out and when we're in the car and I'm riding with people, we still do that. And while I have already gone through it and I have antibodies, I still know that the antibodies does not make me superwoman. And so I still have to be respectful and I still have to be careful. I know we're talking often to a faith-based audience, and I am a minister and I know I'm covered, but God tells me to still use wisdom.
Come on.
We have to still, and that's really important, because we're like, oh, the blood covers and the blood prevails and no weapon formed against me, and 1,000 shall fall at my side and 10,000 at my right hand, but it won't come nigh thy dwelling, and that's all really good. But we've already seen a lot of people who are faithful and who love the Lord die. We've seen some people make some decisions and open up big churches and have services. And we've seen quite a few of those leaderships succumb, those leaders succumb to COVID. So we want to make sure that even though we know God is powerful and we know he still sits on the throne and he has not abdicated the throne, he still tells us to use and exercise wisdom.
Amen. So I'm hoping that you can share some of that wisdom with us today.
Absolutely. So, the state has put out minimum guidelines. They've put out minimum recommended guidelines for churches to participate in and abide by as part of the reopening process. So we are still in phase one. We started phase one a week ago tomorrow. Tomorrow we'll make 1 week in phase one. We know that each of our phases are supposed to last for a minimum of 2 weeks. And during that time period, we are monitoring to ensure that the hospitalization numbers have not gone up, that the number of new cases, well, you have to start with new cases. We want to make sure that the numbers of new cases remain steady, that we don't see a spike in them. We want to make sure that the number of hospitalizations are not going up. We want to make sure that our intensive care units are open and available and that they have space. We want to ensure that our hospitals have the 90-day supply of personal protective equipment. Those are just some of the things that they're monitoring. And what we've seen here in Mount Vernon is we have seen a steady, decline in the numbers and a flattening and leveling off at a low number. We have seen for the fourth weekend in a row, very, very few COVID-related EMS calls within our community. We're seeing deaths leveling off, ICU visits leveling off, and those are very important. But the other thing that we also see and we know is we know that it's getting warmer outside. We know that it's sunny. We know that the coats come off, and when the coats came off, for many people, the masks came off. We know that people are tired of 13 weeks of isolating and being in the house, and everyone wants to kind of do the cookouts, and we want to celebrate children's graduation and spring birthdays and community and cultural events, and many people want to return to their houses of worship. And so, how do we do this, and how do we do it in a way that is very responsible, and does not cause us to find ourselves where we were on April 3rd. On April 3rd, we had 164 new cases of COVID. It was our one-day apex. That's where we saw our highest numbers. Now we're seeing, maybe one case, two cases. I'm not going on Facebook and seeing rest in peace, rest in peace, rest in peace. Oh, another one taken by COVID. Do we still have people being infected? Yes. Do we have people who are still getting sick? Yes. And do we have people who are still dying? Yes, but not in the same numbers as before. It doesn't mean that it went away. It's just that we understand it better, and we understand how to reduce the rates of infection. But none of that will mean anything if we just kind of go back to business as usual.
So you said that we are in phase one now. So what does phase one mean to the churches? What does that allow us churches to do?
I mean, so, they really relaxed not relaxed the restrictions. You've always been able to kind of have 10 people in the church. And so I go to Fresh Start Christian Center here in Mount Vernon, and I know our pastor, they go in and they film a praise and worship. He will film the word. There are minimal number of people there at that number 10 that they need to be, and they film service, and then we get together and watch it on YouTube or on Facebook together. And that's what a lot of churches are doing right now. A lot of churches, temples, mosques, synagogues, different, Catholic parishes, that is what they're doing. And so phase one, it really focuses on reopening of manufacturing, reopening of construction sites, and curbside retail. Phase two will open up more services, including your
And
personal. Phase two will open up personal care services. It'll reopen retail shops and retail stores. So everything from your hair and nails to being able to go and try on a pair of shoes or buy clothes in a store or convenience stores, you'll be able to enter those again. But with each phase, and which each phase and each reopening, organizations have to complete what we call a safety plan. So this safety plan is something that has to be registered with the state of New York. We're asking businesses and organizations to register here in Mount Vernon as well, because the safety plan lets us know how you are going to reduce the risk and prevent the spread of coronavirus within your organization or institution. So churches and houses of worship fall into phase four. So if we are a week into phase one and each phase is 2 weeks, we're looking at potentially now about 7 weeks away for churches to kind of have their full opportunity to reopen. And so this is a perfect time for houses of worship to really start focusing on what do we need to do and what do we need to put in place to use wisdom and make sure that while we trust God and while we believe God, we are also protecting our parishioners. So some of the areas that they speak about in churches are social distancing. So when we talk about social distancing, whether you have pews or chairs, you should be skipping each row within your church. You should be skipping each row. You want to make sure that if people are not part of a household, that there's the same household, that they're sitting 6 feet away from each other. So myself, my husband, my daughters, we could go to church and sit together in seats next to each other. The Jones family should be at least 6 feet away from us on that row, and no one should be in the row right in front of us or the row right behind us. They're saying for singing, when it comes to singing, they don't just want your singers 6 feet away from each other, they want them 12 feet away from each other. Because when you're singing, and we know that the virus is spread through droplets, if you're singing, if you're praising, if you're worshiping, if you're hallelujah, and if you're praising, then there is much more force that goes behind those actions. And there's the opportunity for any droplets to go further than 6 weeks, than 6 feet. And so, if you have a small church, that might mean a soloist or a duet or a very small praise team so that you can keep them separated. So we have to look at that consideration. Protective equipment. They want to make sure that you have masks available for your members, for the visitors who come in. So just like we pass them an offering envelope when they come in, if
Pass my
someone
mask.
comes in without a mask, the ushers need to be right there in the back, passing out masks when people come in, face coverings. Um, and if you see someone whose face covering is not adequate or it's messed up, then you should be giving them one. If these are reusable face masks, then clearly you would have to wash them and dry them and redistribute them. They shouldn't be shared. Even reusable face masks, even when you wash them, they still shouldn't be shared with others. And a complete coverage of the nose and mouth is a requirement for face coverings, even when you are in the church. One of the other things they speak about the categories is limiting the sharing of materials. So tambourines, don't pass the tambourine around. Don't pass the offering plate. Don't pass Bibles, bring in your own Bibles, bring in your own, that you shouldn't leave the Bibles in the pews and hymnals in the pews, because you don't want people sharing unless you're sanitizing them after each use and after each service. They don't want people passing hymnal books and Bibles up and down the rows and across, because if someone is sick, that can cause an infection of another parishioner. Choir robes. If you have a choir and they're using robes, then they're saying after each use they need to be laundered, taken home and laundered. And all of us know that choir robes, after you finish with the choir robe, they just go back in the closet of the choir room, unless y'all have had some really tear down, knockout McDonald's gospel concert where everyone really, really sweated it out, and some people will take it home. So, they're saying if you're not going to wash the choir robe after each use, or people are going to be sharing them, then kind of just put away with the tradition of choir robes right now and choose not to use them. They want musicians to bring their own instruments. And at minimum with your drummers, have your own sticks. Have your own sticks, not sharing the sticks. If you have multiple people who are using the keyboard or the Hammond organ, that you should be kind of wiping it down in between different people using that. So that's very important. And when it comes to like fonts of water or communion, that we shouldn't be sharing cups, shouldn't be drinking from the same wine cup. If you're breaking the communion bread or the crackers, that you shouldn't be passing it around and people just picking out of the dish. Oftentimes we'll put it in a nice dish and we'll cover it and we'll crush it. And then we're like, this is my body broken for you. And everyone's taking from the same plate. So they're saying not to do that. So we know that there are some houses of worship over the years that's just been easier for them to get the little individual cups with a very small wafer that's all piece part of one. It's a little more expensive. And I come from a small storefront church. you know, I've been a tither for the past 27 years. And we know not everyone is a tither. And so when you're in small ministries, sometimes the finances are tight. And so it's easier to, kind of purchase the crackers and pass them around on the cup. The individual single use cup and wafers are going to be more expensive. But look at it this way: if people get sick during communion and they can't go to work for a few weeks and they miss income, then that's also going to impact not only their health, but their tithes. So it's the cost of doing business. And I say that so the cost of doing business for the church is going to go up. The cost of doing business for beauty salons and barbershops is going to increase. The cost of business is going to increase. I signed checks today for the plexiglass that we are having delivered so that we can install it in all of our reception areas here in the city. Last week, for some of the offices where we had cubicles, they changed up the cubicles so that the cubicle separations could go higher. So the cost of doing business is going to go up. And it's going to be more closely regulated. And that's why you have to complete a safety plan. That safety plan has to be sent into the state. We want it shared with the city. And if someone were to come in, they're going to want to see that the things you signed off and you certified that you were going to do in your safety plan, that you are actually doing it. So
I'm glad you brought up the safety plan. Could you speak a little bit more to that? Where could we get a safety plan from? How do we submit it? Where do we submit it?
So for the safety plans, you would go. I will send you out the link because it's very long. It's a long. It's like www.governor.newyork.gov /sites /governor.newyork.gov.files. And it goes on for about 5 or 6 different words after that. So that is a link that we can send out to you and that you could share. But if you just go on the New York State website, they have a whole COVID portal. And if you put in there reopening, then you will see the safety template on there. So it's kind of just natural. But this link right now for me to give it to you.
So is that a requirement of Mount Vernon or is that a requirement of the state?
It's a requirement of the state, but this at the bottom, the last 2 lines, that's the link. It's okay. A long link.
So what I'll do is I'll definitely add that to the comments for those that are watching YouTube, and for those that follow the Moving Forward with the Gospel on Facebook. I'll definitely add that to the group as well. So that's another place where you'll be able to find the link, but as well as would that be NYS.gov?
Yes, NYS.gov. And then they have a whole COVID portal, and you would just go under the reopening area, or you would just go in their COVID-19 safety plan.
And this is a requirement before opening, is that correct?
Before opening, yeah, before opening. And so we tell people, we have a lot of businesses that feel, oh, next Tuesday is phase 2. We're just going to open up our beauty salons, our nail salons, our retail stores. Absolutely not. If you do not have a safety plan in place, the city of Mount Vernon will enforce the fact that you do not open. Because this is it. We're not trying to be difficult. We're not trying to be hard. We're not trying to give anyone extra despair. But I promise you, for the past 13 weeks, it has not been easy leading government and dealing with a public health crisis and an economic crisis all at the same time. The governor has made it very, very clear. Hold on 1 second. Please fire, a few things passing. The governor has made it very, very clear that they will monitor these numbers, and if they see spikes, that they will shut down those communities or those regions. And we don't want Mount Vernon being the cause for a 9-county region to be shut down. We don't want Mount Vernon to be shut down. We've been impacted as a government because stores are closed. We're not getting taxes from the stores, and because we shut down parking for a long time, and we weren't getting revenue because we have so many people who are unemployed. We know that some of the residential taxes are coming in a little bit slowly, and our residents are suffering. We don't want to find ourselves in a place where our entire community and our government and our economy is shut down again. We can't handle that. It's interesting, and it is an economic issue? Absolutely, it's an economic issue. It really is an economic issue. We don't want to put finances before health, but at the same time, we can't afford to continue to operate. People aren't going to be able to pay their bills. Businesses are not going to be able to stay open. Government is not going to be able to continue to provide essential services if we don't get to a place where we can reopen as a community. If we're not getting income as a government, then how do we continue to maintain services and provide services to the community? So it's a catch-22. It's a big catch-22, and that's why we have to be vigilant about ensuring that the safety plans are being followed and being utilized by our businesses.
So speaking of income, I'm quite sure there's a lot of people concerned about that aspect. Well, with the safety plan, are there some things that may cost more than, some that might be a surprise to someone that, wow, I didn't know I have to do this, and this may have a big cost attached to it in order to reopen?
I mean, well, you're talking about churches or
Correct.
businesses. Churches, um, you have to look at the layout and the design of your church. If you have 100 members and you are sitting up on top of each other, but you don't have any other place to build out, then the capacity of your church might go down to about 40 people. So you might have to go to 2 services. And you say, well, because you have to socially distance. Um, like I said, the cost of doing the individual communion cups, maybe what it might take for you to put some type of offering stand. You might want to go out and purchase one of those containers that you could put in the front and people could drop their offering in instead of passing the plate up and down the aisle where 5, 10 people are touching the plate and then it goes down the next aisle. So those are some of the things that you really, really want to consider. Um, you just have to, I did meet with some other churches last week, and I know several of them created reopening teams within their ministries, because some of it's going to be you looking at the design of your building, the space, and what you need to do and how you need to retrofit your building to reduce infection. Of course, having sanitization equipment, making sure that you're having someone who's going in the bathrooms and wiping them down regularly throughout service. It's an added expense if you have to pay for it. Some churches have volunteer committees that do it. But you're going to have to identify what you're going to need to do for your church for yourself. I mean, each church is going to be a little bit different.
Well, let's stay on the income thing, because I will get hung if I don't dwell on this topic. But one of the questions that I heard over and over again, a lot of churches have lost a lot of income, if for lack of a better word. Donations, tithes, offerings has went down for some people. Some people say they've done better, but are they included when small business loans are given? Is there a resource for the church, whether it's locally or state or federal, that we could probably say, hey, this is where you can get a loan or a grant or something of the sort?
Well, honestly, I have not checked to see if you're eligible for churches. Now, if you have a payroll, if you have staff, some churches, big or small, might have staff that is, teaching educational programs or running soup kitchens or services to the community. So if you have a payroll, for small businesses, they didn't say churches, they said not-for-profit organizations. So we have to see if
Yeah.
churches fit on that and under that. But if you have less than 20 employees, less than $3 million a year of income, then through New York Forward, which goes through the state of New York, there is $100 million in loan money for small businesses. Now, I cannot say for sure if churches are included in that, but that is something worth asking about. And, the governor has an Office of Faith-Based Initiatives. So I could also reach out to his liaison from the Office of Faith-Based Initiatives to see if there is anything that can be of assistance to churches.
That'd be awesome. I've definitely heard that question over and over again, and they're wondering, how to move forward. Let's see, one of the other questions that I have gotten continuously. There's been a lot of fear, and I believe a lot of churches wanted to help the community and kind of held back out of fear of causing a spread or, getting infected. And a lot of churches have held back, but they want to be a part of what's going on in the community. Is there room for partnership, even with the city, to say, well, we can't do everything that we've done on our own, but can we partner with you to do something?
Absolutely. We've had different churches work with us to help with food distribution, whether it's at the Dole Center when we're doing a community distribution. We've had some churches help us deliver the meals to the different homes. They've worked with us. We do a lot of weekly call-ins to many of our seniors and some of our other, vulnerable residents. So that can always be a way to help. Whether you're a big church or a small church, if you ever want to donate and help us, purchase some of the things and expand our capacity to serve more people, that would be helpful. Another way churches can help us during this time is really, really to speak about the importance of the census, because we need to make sure that everyone in our community is counted, whether you're a citizen or not a citizen. Being a citizen is not a requirement for completing the census. But it's kind of like if you are hosting another church, right, for dinner, you're having fellowship, you have an afternoon service, and you speak to the pastor and you say, "Oh, about how many people you think you're gonna bring with you? How many people should we prepare for?" And they say, "Oh, 25, 50," and they show up with 100. That kind of blows your plans out the water.
Yeah,
And
I didn't buy
so
water.
you may not have prepared enough. And that's what happens with us with the census. If we have to serve 100,000 residents, because it's really 100,000 residents that live here, but we've only counted 70,000, then the money that we're able to get from the federal government or the county government or the state government is going to be based on those we counted, and not necessarily based on the number of those who live here and we still have to serve. So we could really, really use the church's help. This would usually be something that we would be able to come around to the churches and speak to, or set up partnerships where we could do, help people fill out the census after service or after Sunday school. But because the churches, many of them are closed, or most of them are closed, except for doing online virtual service, we've really, really, really lost access to a very large segment of the community that we would have accessed through church. So whether you're sending out a robocall or an email blast or a text blast, or part of your sermon at the end of your sermon and Bible study, if you could just really share with your members, that it would be helpful for them. It is very critical for them to complete the census, because that's how we get funding for roads, buildings, schools, medical care, mental health services, employment training, youth programs, hunger relief efforts. Everything that we do and all the money we get from other levels of government are based on our census numbers.
Very important. Very important. Thanks for sharing that. Contact tracing. Um, so now I've been hearing, contact tracing, contact tracing, contact tracing. What does that mean for the church? How do they comply, or should they
Well,
meet?
so contact tracing, it would be really great, even if within the church, that you could have a few of your people trained. It's a 5-hour class. I took it Memorial Day. I took it on Memorial Day. After I came in from the motorcade, I spent about 5.5 hours on the computer going through the different modules and taking all of the different exams. So contact tracing, what is that? Say I tested positive for COVID, and when the Department of Health or the agency that has my test contacts me, they're going to go, "Hi, Miss Patterson Howard. This is the Department of Health," and they're going to confirm who I am. Then they're going to let me know who they are, and then they're going to say, "Well, we're calling with your COVID results, and you've tested positive." And so they'll say, "What does that mean?" And they'll talk to you about medical services and things that are available. But then they're also going to say, "Let me ask you a few questions, because we're here to help and we want to make sure that, no one else in your family or your friends or in your circle or in your church gets ill. So can you please let us know, when your symptoms started?" They'll ask you that. And then they'll say, "Okay, well, if your symptoms started on June 1st, then we know that you were most likely infectious for 2 days before that." So they're going to say, "Well, who were you with for the last 2 or 3 days? What are some of the names?" If they say, "Oh, well, I went to choir rehearsal," then they're going to say, "Okay, well, how many people were at choir rehearsal, and do you have access to their names and numbers?" Because then there are contact, you're a case, and that person, those people are contacts and you were around them and most likely not within 6 feet distance, and you were around them for more than 15 minutes, and there's a possibility that there could have been transmission. So they would reach out to those individuals. Now, they're never going to tell them, oh, so and so is positive. But what they will say is, we have reason to believe that you could have been exposed to COVID-19. And so we're calling and we're going to help you get a test done for yourself, or we're going to tell you to pay attention and look to see if you have any symptoms develop. And if you do, then this is where you can reach out for help. But they're going to reach out to your contacts. They're going to ask you for your contacts. And then they're going to ask for you to shelter in place, for you to stay at home. They're going to say, well, you just tested positive. We have these results. They're going to ask you about your medical condition, your medical care, your medical coverage. They're going to find out, what do you need to help you stay in place as to prevent the spread of this. And so if you need food, they're going to make sure that they help you get food in the house, whether it's through a food bank or whatever the connection is, they're going to do that. Um, if you live in an apartment with your family and your children, um, and you really don't have a way to isolate and to quarantine, to be quarantined from them, then they might offer for you to go to a hotel and they'll cover it. But they have hotels that they're using to take people who are COVID-19 positive and put them there. Or if they need to move the family and have the family stay for a few days at a hotel, then they'll move the family. But they want to make sure that everyone in the household is now not going to get infected because this one person got infected. And we've seen that. We've seen houses of up to 7 and 8 people in a house all be COVID positive. I can tell you, my family went and they got their antibody tests, and my husband and daughters, they're not antibody positive. But part of that comes from my work in the public health field for many years. And when this came out, I knew that I was going out every day. I didn't feel sick, but I knew that I was going out and interacting with the community on a daily basis, when my family had the opportunity to kind of stay home and work from home and shelter in place. So when I went home, I just automatically was very careful on how I interacted with them, made sure I always washed my hands, for the most part, socially distanced from them. And it worked because no one else in my house is antibody positive. So that's very important. But the contact tracers are going to ask you, they're going to ask that you stay home and that you isolate for a period of 2 weeks. They're going to, like I said, want the name of people who you've been in contact with, and they will reach out to them. They will ask that you continue to trace what's happening with people that are in your home. And they're going to call back and check up on you and see how your mental and your emotional wellness is, as well as how your symptoms are coming along. So it's kind of like a COVID partner, a COVID buddy who's going to check in with you and make sure that you're okay.
So in the event that someone from our congregation tested positive, they went to the hospital, or they spoke with the contact tracer and said, I went to church on Sunday, but I don't know, I can't tell you the name of everyone that was there. Would they contact the church
Absolutely. They're going to contact the venue.
themselves and then require the church to provide name? And
They're
is there a specific documentation that we're required to present in that case?
they're going to ask that you give up the names of the people who were in service, and who and contact information for them so that they can reach out to them and let them know that they may have been exposed, and that these are the steps that they should now take. Either quarantine yourself or isolate yourself and see if symptoms develop, or if you are experiencing symptoms, then go and seek medical attention as well as a test for confirmation.
And would the protocol change within the church once someone has tested positive? Would you have to do something differently than what was
I
allowed?
really, I really can't answer that necessarily. There are times where you could follow all of the protocols and someone still get infected, or the virus is still passed on. So I really can't speak to that. Now, if your church became a hotspot and you had 50 people at church, and you had 15 or 10 cases come out of your church, they're definitely going to come and say, what are you doing? Because even if you have people here, if you were wearing your PPEs, if people were social distancing and you had people sitting 6 feet away from each other, if you didn't have people standing in the front all lumped up in a small choir pit, singing, praise and worship and gospel songs, then we may not have seen this level of spread within your facility. So I'm sure that they will keep an eye on you.
So, kind of tying in what's going on with where you're saying phase 4. You're
Mhm.
saying phase 4 is
So phase four, if we're looking at phase four, we're kind of timing phase four to be at, hold on, let me just open up my calendar, kind of around July 7th or 9th should be when phase four, yeah, about July 7th should be when phase four would, that's right after the 4th of July weekend when phase four should really kind of come up. But phase four can always be
oh, well, that's
delayed.
good news.
It can be delayed if we see any type of spike in between any of the phases. Everything can be delayed and pushed back.
Which is what I was kind of concerned about. Seeing all the events that are taking place now.
Mhm.
Pretty much every rule that has been put in place has been, thrown out the window. Even some of the things that you've mentioned, as far as keeping the gathering small, and you spoke about singing and shouting, and the projectiles.
Laying on of hands, I mean, all of that. Look, I grew up in, I've for the last 27 years of my life, I've been part of, Pentecostal Apostolic Kojic, and our charismatic worship style definitely, that's a lot of potential projectiles of droplets. Um, we have to really look at what we're doing, the shouting and the holding and the laying on of hands. But those are decisions that you're going to have to make as a faith leader.
So, in your opinion, with what's going on now outside of the church, what's going on in the cities with the
The
protests
protests.
and the gathering, are you concerned about us being delayed to get this phase 4?
We just don't know. And I mean, we're holding a rally here tomorrow at City Hall. We're going to ask that people social distance, and we're asking people to come with a mask, period. That should, a mask doesn't, a mask reduces the risk of the virus being transferred from person to person. And so while people are in a lot of pain and people want to come out and they want to rally, they want to be able to speak about their challenges and their trauma and express what they would like to see going forward, we want to make sure that we're providing a positive platform for that to happen. But at the same time, we're asking that people come in peace and that they come with their own personal protection of a mask.
I'm looking forward to it. That should be awesome. Um, Funeral services.
Mhm.
I'm going through the questions as I have them here.
That's fine.
Will that change as we go through different phases? I believe now it's limited to about 10 or
10.
people, 10 people. At what point does that change?
I mean, I think, as churches reopen, and that's part of the services there. And so, as funeral homes fully reopen, then I think some of those restrictions will be relaxed. But again, it's about using wisdom, and making sure that we're paying attention to the numbers and the trends.
All right, awesome. I'm very mindful of your time, and you've been with me for a while. I do appreciate you hanging out with me.
Okay.
Is there any thing that we may not have covered that you think would be very important for the churches to know from a government standpoint?
The government is not here to monitor the church. And there is a separation of church and state. That doesn't mean that we don't have the right to enforce public health guidelines, but we're not looking to hurt. We're not looking to hurt ministry. We're not looking to hurt anyone. For me, the foundation of who I am is my faith. And so we're not looking to come with a heavy hand, but we're asking that all of our organizations be responsible and be respectful of not only their own health, but the health of those around them. And if we feel that that is being compromised, we will address it, but we're coming to provide technical assistance. I would rather see the city of Mount Vernon be in a place to provide technical assistance as opposed to us just becoming a COVID oversight agency. We don't necessarily have the resources to do that, but we have to make sure that people are following the rules so that our community does not have to experience what we've just come through. It's still not over, but it is much better than what we were experiencing a few weeks ago. And now on top of this pandemic, we're dealing with the fact that we can't breathe. So, our resources are we have competing needs, and protests and rallies don't necessarily put us in the best situation for dealing with COVID. But at the same time, if you don't give people an opportunity to come together and express themselves, then you are leaving them to find other ways that may not be as productive to express their pain and their anguish.
I believe if there's any time where we need spiritual and moral guidance, it's now.
Amen.
We're hurting. We're
We're
hurting.
hurting.
I'm hurting.
Yes.
I can definitely speak to that. But Madam Mayor, I really do appreciate your time. I appreciate you hanging out with us. Anyone, if you have any questions, feel free to post it in the group that's moving forward with the gospel on Facebook. Feel free to leave any questions here on YouTube. I reach out to Mayor. I have a new friend. And they answer my calls. This is so awesome. And we thank you for the awesome job that you're doing. I do realize that within 6 weeks of you entering an office, the world just collapsed.
It changed.
And then 12 weeks after that, there's another major issue. And I just want to commend you on the wonderful job that you're doing. Thank you for leading the city in the way that you are, and thank you for spending some time with us today.
Amen. We desire your prayers as we will be praying with you. And as we trust God, I ask that we will be able to trust each other, and that we understand that our liberties are our liberties, but we want to take into account the health of those who are around us. And by acting in a way that's less than responsible, we can be impacting others around us. So continue to do work, continue to keep the faith, and continue to minister the gospel. And let me tell you, I've said this about a year ago, or more than a year ago. It was really in my spirit that we were going to experience a shift, because it's about not just about building the church, it's about building the kingdom of God. And while the church buildings are closed, I think many of us have been forced out of our territorialism, and we are preaching the gospel, and it is reaching people who may not always feel comfortable coming within the four walls of our faith institutions. And I can tell you, trust me, I do miss assembling together in the house of the Lord, but I also really, really enjoy seeing about 4 or 5 different sermons on a Sunday morning in a way that I wouldn't get to do if we were in service. So there are definitely drawbacks. We are people of relationships, but at the same time, I'm hearing a diversity of word, and I make sure that the table that I'm eating from is well set.
We came to realize that Bedside Baptist wasn't that bad after all. But I do thank you for your time, and I thank you for that word, that encouraging word. I thank God that He has put you where you are, and we're benefiting from that even today. So, Madam Mayor, one last time, I just want to thank you and tell you I appreciate you, and hopefully we can do this again. I'm quite sure I'm going to get a storm of questions. Oh, why didn't you ask this? And I just apologize to everyone. I tried to ask as many questions as I can, but I do want to be respectful of her time and understand that there are other needs in the city. But I believe that we'll be able to do this again. Maybe in a different form, and bring a few people on. Thank you very much, man.
You're welcome. And Ms. Robin Mack is helping to lead the reopening efforts for all of our sectors of business here in the city of Mount Vernon. And she can be reached at 914-665-2362. And her name is Robin Mack. So she is definitely helping to lead this effort here in the city. And she is also available for questions. But I would encourage people to go onto the New York State website, go under the COVID portal, and look up information for reopening and safety plans.
Perfect.
Okay.
Thank you very much, Madam Mayor. You have yourself a wonderful evening.
You too. God bless. Bye-bye.